Hello everyone, welcome to my channel Dentistry with Kashaf. Let's talk about lichen planus. Lichen planus is a chronic inflammatory condition that can affect the skin, mouth, nails, scalp, and genital mucosa. It occurs when the immune system mistakenly attacks cells in this tissue and it's not a contagious. It's wholly immune. What are the typical features of this condition? As you will see the skin lesions like purple, reddish purple, flat top, itchy bumps on your skin like you can appreciate here. You will appreciate it on a forearm, ankles, and lower legs and may leave dark pigmentation after healing. Also, you will see some signs and symptoms on nails. Longitudinal ridges you can appreciate on these nails, and thinning or splitting of the nails, and sometimes in severe cases they may be lost. Oral lichen planus like these will be a white lace like line collies becomes dry. We commonly heard it in oral pathology, usually on a buccal mucosa inside the cheek, and may cause burning pain or ulcers, especially with the spicy foods when you eat. And then going towards your scalp, obviously redness and itching in your scalp and hair loss in the affected area. Going towards the different types of lichen planus, we know that reticular type, erosive type, atrophic type, plaque-like, and bullous-like. Reticular type, obviously you are going to have a white striae, lace-like pattern on your inner cheeks. Then you having erosive ulcer, these are very painful. Then you have atrophic lesion, like very smooth, shiny, reddish area, which are very prone to having pain on spicy foods and any drinks. Plaque-like lesions, like you will appreciate white plaque-like lesion here. And in bullous condition, you are going to appreciate bull-like, like blister type of condition. Then moving towards what are the different causes of such condition. Of course, your immunity, your genetics, your medications, any viral infections like hepatitis C infection, any tooth restoration like you might have allergy from any amalgam restoration or any other kind of dental materials, your stress condition, and your any allergic like autoimmune disorders. What are the histopathological features of this condition? You will see the sawtooth retipegs and degeneration of basal cell layer, dense band-like lymphocytic infiltrate beneath the epithelium, and cavity bodies, which can call as colloid bodies too. Okay, you can appreciate a very beautiful picture histopathology of the lichen planus. First of all, you are going to appreciate here is a hyperkeratosis, like increased keratin layer is increased, like thickening of the stratum corneum, like your outer layer of the skin is increased, you can see. And then hypergranulosum, increase the granulosum layer is also increased, you can increase hyperpigmentation here. In sawtooth retipegs, like these kind of things you are going to see as a tooth type structure is present here, and also the basal cell, like the basal cell degeneration. Of course, there will be some basal cell degeneration like like bullous type of condition, and cavity colloid bodies. You can appreciate here is reddish cavity and colloid bodies. What are these? These are apoptotic keratinocyte like eosinophilic hyaline bodies. And what are dense band like lymphocytic infiltration? Of course, in subepidermal layer, like you can appreciate here is a lymphocytic infiltration. Okay, then moving towards the treatment categories for these condition, like you can go for immune modulation therapy like immune therapy, topical steroids, and systemic steroid in severe condition. Then any of the dental restoration which is causing this allergy could be replaced, like your amalgam restoration. And of course, the meditation is very important for your stress condition, and you can also go for counseling session with your psychiatrist. And then of course, the most important is the dental hygiene in this condition, and you are going to hydrate a lot and avoiding spicy foods and going for that of the eat healthy food. Okay, and then you have to avoid those drugs which is actually causing it and screen for any hepatitis infection. But still you have to visit your dentist for proper checkup and intervention, because that is must. Thank you so much for watching. Don't forget to subscribe my channel.